So here we have a 53-year-old woman that came into the emergency room complaining of left-sided abdominal pain. So they got her an enhanced CT scan of the abdomen, which you guys can see here as much as I do right here. And we are going to look for the cause of such pain. The patient also says she could feel feverish, didn't measure the temperature to see if she was actually with a fever, and she also feels kind of nauseated, but the left-sided abdominal pain is the main cause of her coming to the ER. So this is an enhanced CT scan, and we are going to do as we always do. I'm going to roll the images from up to down a few times so you guys can see, can spot the disease and write down in the comments below. Okay, so let's start it. Liver, spleen, pancreas, kidneys, and whatnot, going down, 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 until we reach the pelvis and the thighs. So just to remember, this is left and this is right, anterior and posterior. This is an axial series of unenhanced CT scan images. So this is the gallbladder, it's on the right, so is the liver. The spleen is right here on the left, so I'm going to roll it once again to see if you guys can spot the disease. Up and down, up and down, up and down, just going over, up and down, and here we go. So I have already seen the disease, but as I have this trick that as soon as I see the major cause for the exam to be ordered, I leave it aside and look for other causes of or possible diseases that this patient might have, just to be sure that I won't miss anything major, any other important feature of this exam. So let's begin from the top. The liver seems all right, gallbladder also, spleen and pancreas, and of course I know you guys have already spotted this small kidney stone right here. This bright spot is a kidney stone. It's on the uppermost kidney calyx, right on the superior pole of it. It's a microcalculus stone, a minor micro stone, because it's less than 4 millimeters. It's a 0.3 centimeter stone on the left. So pancreas is fine, peripancreatic fat also, adrenal glands fine. Although we have a kidney stone on the left, there is no hydronephrosis. Inferior vena cava and aorta are fine. Colon on the right is fine. I can see right here the appendix. I know you guys are screaming on your chairs, complaining I haven't mentioned this half partial metallic arthrodesis of the lumbar spine. There it is, I have mentioned it. Settle down, and we finally got to the pelvis. So I can see the uterus is fine for her age. Also, the urinary bladder is half full, half empty. The Rectum is fine. Going over the bowel, I don't see much. Bowel was fine. So, besides the small kidney stone on the left, I can't really tell much about this exam. So let's focus our attention to the problem at hand, which is right over here, left-sided inferior quadrant pain. So let's get back. So we have here a left-sided abdominal pain, and of course here it is. This is it. There is straining, fat straining, left iliac fossa, and we can see there is thickening of the walls of the sigmoid colon and a bunch of small diverticuli. So diverticulosis plus thickening of the wall plus fat straining. This is the hallmark, the easiest diagnosis you can make in such cases. This is acute diverticulitis of the sigmoid colon. So this is a great case of an acute abdomen that we can readily do a fine diagnosis with a simple unenhanced CT scan of the abdomen. So I hope you guys have liked this one. If you are interested in watching something really similar, just click here and keep watching. I'm pretty sure you're gonna enjoy it. And until next time, hit that like button and subscribe to the channel. See you in the next video.